Well, this is terrible news. He's our president. We don't want to see a 78-year-old man catching this disease, even with vaccinations. We know this is the age group that is most vulnerable. But look, let me be blunt. After months of virtue signaling of Biden wearing masks outside and walking on the beach wearing masks, we saw him shaking hands with foreign officials on this trip instead of fist bumps. I met with President Trump. He won't shake my hand. He doesn't shake hands because he's worried about the transmission of this disease. And look, Biden's only human. You want to shake somebody's hand. But if you're a 78-year-old guy and you're president of the United States, you have to be smarter than this. And I worry that that is where he may have gotten the virus.
He's actually 79, so he's a little older, obviously. I think he's had a little bit of health issues prior. I bring that up because we know that underlying conditions or maybe some other health issues that have taken a toll on your immune system, that doesn't play in your favor in terms of this virus from what we know so far. Mark Halperin, how does this affect how this nation is running? As you highlighted, you touched on this earlier, that he is doing things from isolation, according to the White House, the press secretary. But there's a lot on this president's plate right now, with low approval ratings, with inflation skyrocketing, with obviously their push for their climate agenda as well, with House Democrats trying to push through legislation they want to get done as well, meetings that maybe the president would want to be a part of. He may be doing this from isolation, but according to the White House, if they're mild symptoms, but he is experiencing symptoms. He's 79. He would need to rest.
Yeah. Look, we can't say it enough, as Fred said, it's President of the United States, and we all wish him the best. However, I will say this, as a journalist who's covered presidents and presidential candidates who've had health issues over the years, this is a bipartisan thing. This is not a shot at this White House or Democrats. Typically, you don't get the full truth. President Trump and his team did not fully disclose the nature of his illness in real time. It's a balance between keeping everybody calm and the president wanting to have some privacy, but also the public's right to know. And right now, with so many international and national crises going on, with a president at a very busy time on Capitol Hill, very busy time with the midterms approaching, we're going to need, as journalists on behalf of the American public, to demand transparency. The statement today was a good start. Let's see how they do at the briefing this afternoon. But not just whether he can do the job now, which again, I don't care how much resources he has around him. He cannot do the job the same way in isolation in the residence. But also, how much will they disclose? They say they'll tell us daily how he's doing, but what will that mean? They didn't say what his mild symptoms were. If you're a government that's fully transparent, the world, the markets, the American people watching this, what are his symptoms? How bad are they? We need to know more, and I'm hoping that this White House will set a precedent for disclosure and transparency, which has been sorely lacking in my experience with past presidents and past presidential candidates.
All right, panelists, if you could stand by, we'd like to get your topics throughout this developing news cycle. In the meantime, though, we welcome in Dr. Deborah Birx. She served as the White House coronavirus response coordinator under President Trump from 2020 to 2021. Dr. Birx, thank you very much for coming on today. Again, as we've learned, President Biden has now tested positive for COVID, experiencing some mild symptoms, and is being treated with Paxlovid. Tell me about what you think he might be going through right now.
Well, first, I really appreciate them announcing how important it is to test, particularly if you're over 70, and how important it is to immediately get Paxlovid. And so to all of our people, all of our Americans across the South, where the virus is moving rapidly and expanding, you can see how contagious this is, even despite vaccines, even despite boostering. And people over 70 are still getting infected. It's the highest rate of hospitalization in this country are people over 70. And so I hope every American has access to Paxlovid and testing as the president did.
Can you talk about Paxlovid as well? Maybe some may not know about it. It kind of made headlines when I believe Dr. Fauci began taking it as well, despite being vaccinated, fully vaccinated and boosted. Explain to the viewers, if you can, exactly what this viral treatment does.
Well, it's really important because we're still seeing hospitalizations in vaccinated and boosted individuals. And so we want people to not be hospitalized. And I think it's really critical that those individuals over 70 are testing regularly and find their infection early, because Paxlovid works early. It's an antiviral. It's actually an antiviral very similar to antivirals we used early in our HIV. It's very effective, but you have to get it early, and waiting for symptoms, significant symptoms, is too late. And so I think the president illustrates clearly how important it is to be testing and getting access to Paxlovid quickly.
Yeah. At the same time, though, as president of the United States, life goes on. You've got to lead this country, although there is a fear of contracting the virus. He avoided it up until this point. So many Americans, as we know, have contracted COVID and have had different experiences with the virus here. But as you're watching the president and as he enters his recovery time period here, what advice would you give him? Sort of how long of a quarantine can the American public expect for the president to sort of be out of commission?
Well, we don't want him to experience rebound. And I know the studies aren't complete, but people over 70, particularly the president, people like Dr. Fauci, they probably need 10 days of Paxlovid to really get complete control of the virus, because we know that he's potentially antigen positive for at least 10 days. If you rebound, that could extend to 2 weeks. And so obviously we want him back on the national and international stage as quickly as possible. But the most important thing that he can do right now is to really take care of himself and to make sure that he's eating well and staying hydrated. It's hot out there in general, and hydration is so important. So in addition to taking the drugs, he really needs to take care of himself, as all Americans should do who get COVID. And I'm so glad you mentioned there's a spectrum of disease. And I think that's what's really important for Americans to understand. Acute disease can be no symptoms to very serious symptoms. And that's hard for people to get their heads around always.
Dr. Birx, talk to me about the White House. If you can, take us back in the White House. As we watched you there for more than a year within the White House, the president is surrounded by so many people, so many advisors, so many policymakers, meeting with so many people within this White House. Finding out the news from Karine Jean-Pierre, the White House spokesperson, that the president has tested positive. What would be happening at this time within the White House?
Well, everybody, obviously they should be doing great contact tracing. So everybody who was exposed to the president within the last 24 or 48 hours has to be testing regularly to ensure that they don't become infected unknowingly. He's surrounded, there's a lot of young people in the White House. Most likely they won't have symptoms, and so they could be infected and unknowingly spreading the virus. Certainly he got exposed somewhere. It just reminds people these are this variant and each variant, because it's trying to get through our immune, penetrate our immune that we've gotten either from vaccines or from prior infection. So it's trying to always escape those. That's what viruses do. And we have to be smarter in what risk we're willing to take and how we're going to mitigate those risks. And we have to be smarter about testing and access to Paxlovid. So for the next week, people in the White House and people who were exposed yesterday to the president need to be actively testing so that they can find their infection early and not pass it to others, particularly people in multi-generational households. It's really important that if you're a young person and you're in a multi-generational household, that you are testing to make sure that your elderly mother or grandmother or elderly aunt doesn't get infected. And if they do, you know where they're going to get Paxlovid. Yeah,
you talk about sort of how age plays into those most vulnerable for having a serious case of COVID. We talk about the spectrum of the illness as well, the impact on individuals, but also your medical history, right? How does that play into, possible severity of the virus if you've got those pre-existing conditions?
Well, that's what causes actually severe disease in younger people. And unfortunately, we're a country of pretty significant comorbidities. We're, I think, number 3 in the world for obesity. We know obesity increases your risk for diabetes and hypertension, and that increases your risk to severe disease. And so America in general is fairly unhealthy. And I'm hoping that this COVID pandemic wakes up all of us to our individual health, and secondly, wakes us up to the poor access that our rural counties have. I mean, our rural counties are dying at a higher rate because they don't have the same access to healthcare, testing, and Paxlovid. So I'm thrilled that the president did, but let's make sure all Americans do. And let's make sure that we address these access issues in rural America.
Sure.
People are dying in red counties at higher rates because they don't have the access to the same health care that urban Americans do.
I want to hone in on the president, if I can, with you here. We popped this up, mild symptoms. That was the release from the White House. If we can go back, what could be some of those mild symptoms that this 79-year-old president of the United States could be experiencing at this moment?
Well, with this variant, it's primarily a significant sore throat and headache. And so each of these variants have their own unique symptoms. So most have headache, most have low-grade fever. Certainly in his age group, he may have those things, and a pretty significant sore throat. And probably what really alerted him was the sore throat. And what we're trying to prevent is that virus evolving into lower respiratory tract, which the boosters will help with. But some people that have even been boosted end up with infection in their lower respiratory tract. And that's what gets people in trouble. And so Paxlovid will really dramatically help with that. And that's what's really important. He's getting the right medical care to have the best outcome. And I just hope every American has that same access.
That's Dr. Deborah Birx joining us with this breaking news and reaction.